Did you know that 98% of all drug users use prescription drugs as their drug of choice? Or that over 16,000 people overdose on prescription painkillers every year? I imagine you probably heard that statistic before and thought, that's a lot of people. I know I have. But have you ever thought about what that statistic actually means? It means that a doctor prescribed a patient a painkiller, maybe for a surgery they were having. And then after the patient recovered, they continued to take that medication, regardless of no longer having any pain. The patient then became addicted to the medicine, and then in most cases ended up overdosing. This is true of all prescription drugs, not just painkillers. If the doctor had tried any other treatment first, the patient would never have gotten addicted in the first place, and therefore never have overdosed. One such treatment that the doctor could have tried first is music therapy. Music therapy is more effective than prescription drugs because music therapy has had more successes in treating stroke victims, has fewer side effects, and is non-addictive. In the United States alone, 19.7 million people are addicted to some type of illicit substance. These people are fathers, mothers, sisters, brothers, daughters and sons, best friends, and co-workers. Imagine if it was your friend or family member that was addicted. How would that make you feel? How would that affect your life? When I was diagnosed with anxiety and depression in January 2021, I was immediately prescribed anti-anxiety and anti-depression pills to take. I was told that I would feel better in a matter of weeks. However, this was not true. If anything, I felt worse. I no longer felt like myself, and I was still having a lot of anxiety. When I brought my concerns to my doctor, she took me off the medicine, and I started therapy. It was only then that I started to feel like myself. With this in mind, I would like to share with you why music therapy is better than prescription drugs. Music therapy, in one way, music therapy is better than prescription drugs, is because music therapy has had more successes in treating patients who have suffered from strokes. When a person has a stroke, several parts of their brains are damaged. As a result, they may suffer from memory loss, whether it be from visual or verbal. Verbal memory is the memory of names, stories, and information. Visual memory is the memory of faces, shapes, and locations. According to the National Library of Medicine website, there are no current medicines that can reverse memory loss after it has occurred. The doctor may prescribe medicines that have been approved for Alzheimer's, but there are no medicines that can reverse the effects after they happen. The Alzheimer's medicines only stop further loss. They don't bring back those lost memories. However, music therapy has had several successes in reversing memory loss, particularly in stroke victims. According to the scholarly journal, Reminiscent Music Therapy combined with robot-assisted rehabilitation for elderly stroke victims, a pilot study written by Quinn Liu and Associates, music is the most common way in which nostalgia is evoked. This is because music stimulates parts of the brain that are associated with emotion and can summon memories that have been previously forgotten. Experts have seen that a certain song or artist that a patient liked when they were younger can help bring back those forgotten memories and can create strong associations with events, peoples, and places. The more that the person listens to that music that they like, it is more likely that the memory will become more vivid and will become easier access to the patient. Furthermore, music therapy also helps with other side effects, such as loss of communication skills and motor function. According to the scholarly journal, potential benefits of music playing in stroke upper limb motor rehabilitation, written by Jennifer Grass Sanchez and Associates, music stimulates the damaged areas that are caused by strokes and promote the recovery of language. There are two ways that music therapy can be used. One way is listening to music, which helps with memory loss, which we've discussed. The other way is by playing an instrument, such as the piano or guitar, and singing. Singing helps with the communication skills, while playing of the instrument helps with motor function. Another way music therapy is better than prescription drugs is because music therapy has fewer side effects. When a doctor prescribes a patient a medication, they will list the possible side effects that may occur. Side effects vary from medication to medication, but according to the Drug Watch website, the common side effects include nausea, rashes, fever, weight gain, weight loss, insomnia, heartburn, dizziness, irritation of the eyes, irritation of the nose, irritation of the ears, and pains in the chest, arm, and leg areas. Severe side effects are rare, but they do happen and range from permanent disability to death. According to the National Library of Medicine website, two-thirds of the American population that are over the age of 75 take more than 5 medicines a day. This is known as polypharmacy. When a person takes this many medications, it is more likely that severe side effects will occur. On the other hand, music therapy is safer and is low risk. However, it is possible that painful or unwanted memories may arise. According to the Cleveland Clinic website, while rare, music can trigger unwanted or painful memories. However, to avoid this, the therapist will ask questions about any trauma or possible triggers before the therapy begins. As a comparison to drug side effects, music therapy side effects are a lot less extreme. There is only one possible side effect, which can be avoided if done properly. While drug side effects range from nausea to death. One final way music therapy is better than prescription drugs is because a person cannot become addicted to music. I imagine that everyone in this room knows someone or has known of someone who's been addicted to drugs. However, what is shocking is that most people become addicted to drugs, such as painkillers, that was prescribed by a doctor. This is seen in the scholarly journal, Misuse of Prescription Illicit Drugs in Middle Adulthood in the Context of the Opioid Epidemic. According to the article, out of 12,300 people, 7.3% said they had misused prescription drugs at some point in their life. This equates to around 898 people. Before they were addicted, these people had average lives with families and jobs. After they became addicted, their lives fell apart. According to the National Institute of Health website, when a person becomes addicted, they have no control over their thoughts or actions. The only thought in their mind is the need and the want for that drug, and they will do whatever it takes to get it, regardless of the consequences. They destroy friendships, damage their families, lose their jobs, and in most cases, lose their life. Unlike drugs, a person cannot become addicted to music. And music cannot destroy your life like drugs can. If anything, music can only help your life and increase your life, as we've discussed earlier. According to the Healthline website, music habits can become problematic, but mental health experts say that a music possession cannot become an addiction. Research has shown that when someone listens to music, particularly music that they like, dopamine is released. In theory, it is possible that a person could become addicted to the release of dopamine. However, experts say this is extremely unlikely. We have discussed today how music therapy has had more success in treating stroke victims, has fewer side effects, and is non-addictive, and is therefore better than music therapy. Most music therapy experts suggest that doctors should prescribe music therapy first, or any type of therapy, before prescribing any type of prescription medication, as music therapy is overall safer. But what do you think? Would you rather be subject to extreme side effects and possible addiction, or do you want to have a more personal experience with music therapy?